You toss and you turn. You kick off your sheets, you fluff up your pillow. None of it does any good. The signs of an unexplainable sleepless night. We've all had them from time to time, but when difficulty initiating or maintaining sleep occurs nightly and it results in daytime fatigue and drowsiness, physicians diagnose that string of sleepless nights as insomnia.
Insomnia is the inability to sleep. There are a variety of different types of insomnia. I break them down into two categories. There's trouble falling asleep, and there's trouble maintaining sleep. So some people have a hard time getting to sleep in the beginning of the night. And there's a variety of different causes of that type of insomnia. Some people just can't do it. They have a really hard time with some of the endocrine factors, and your body just doesn't do what it needs to do at night to get you ready for sleep. There's also an insomnia called problems with sleep maintenance. You fall asleep well, but then you're interrupted multiple times during the night. Once you're interrupted, sometimes then it's hard to go back to sleep after that original interruption. The most common cause of issues of sleep maintenance is noise, and it just has to do with the environment that we're in. Bed partners getting into bed after we do, the television coming on, dogs barking, kids crying. That's the most common cause of difficulties with sleep maintenance. Some of those are fixable and some of those aren't. Another major cause of trouble with sleep maintenance is sleep apnea. So sleep apnea is trouble with breathing stopping or slowing during the night. Usually it causes just small bits and pieces of wakefulness. We don't even realize it, we sleep right through it. But sometimes the sleep apnea is significant enough that it actually wakes us from sleep and we're up.
Once insomnia is present and a long-term problem, an evaluation by a sleep specialist should be your first step in regaining some shut-eye.
There are things called sleep studies that monitor people while they're sleeping, looking for organic problems with sleep. Sleep apnea, restless leg syndrome, periodic limb movement disorders, different types of REM behavior disorders, different types of sleep pattern abnormalities. Those are sleep studies. Most of the time it's really just a conversation.
After the sleep specialist detects the probable cause of your insomnia, treatment can begin. Early treatment of chronic insomnia, which is insomnia that lasts for a month or longer, is vital.
So some people just have insomnia. They have primary insomnia. They've been poor sleepers their whole life. They're doing everything right. Their sleep hygiene is perfect. Their room is perfect. There's no noise. There's nothing else going on. And these people still can't sleep. Sometimes you just need medicines. And there are a variety of different medicines. Antihistamines have a side effect, in addition to treating allergies, of making people feel tired. There are some natural medicines like melatonin. Melatonin is what our body naturally produces to help us warm up and to develop sleep. You can buy melatonin over the counter. There are things like valerian root, magnesium. These are also medications, really herbal treatments that are available just in your local pharmacy. There are prescription medicines. Again, a huge variety of prescription medicines. The typical ones we talk about are things like Ambien, Lunesta, Sonata, medicines that are used usually in the short term to help people sleep better, maintain their sleep, and really initiate sleep. There are newer medicines. There are medicines that now work by turning off wakefulness. A lot of medicines like the Ambien and Xanax and Valium all work by promoting sleep. There are newer medicines that actually turn off wakefulness. The result is the same. You fall asleep, but they work in a different portion of the brain. There are some antidepressants that actually work not as great for antidepressants, but they work really well to help people fall asleep. So there are a variety of different medications that one can use to help you sleep.
There are some basic tips to falling asleep. We call them sleep hygiene. First, maintain a regular wake-up time. No sleeping in on your days off. In addition, try to go to bed at the same time every night. Yes, you're going to have a bedtime again. It's also important to avoid common sense things that can disturb sleep. Avoid naps. You can't sleep at night if you're also sleeping during the day, right? Also, avoid alcohol, nicotine, and caffeine before bed. Caffeine can have an alerting effect even 10 hours after it's consumed, so try not to drink caffeinated beverages after noon. There are also medications available, but anything you take will be paired with good sleep hygiene.
The biggest cause these days in insomnia is light. So light is the biggest proponent of wakefulness. which is why we feel most awake during the day. So what do we do at night that makes us not be able to sleep? We are on our phones, on our iPads. We have 94-inch televisions in our living room, and it's shining light, and that light actually promotes wakefulness. So we get into bed, we try to unwind, and we play 94 games with a really bright light on our iPhone. It promotes wakefulness. It makes it more difficult to fall asleep. So some easy things to do are put your phone away, or at least turn down the brightness on your television. Try not to have a lot of stimulation in the bedroom, and stimulation is really light.
It's also important to know that some very common causes of insomnia are underlying anxiety or mood disorders like depression. If you feel that such a disorder is present, talk to your doctor about it. Treatment of that underlying mood disorder can often resolve the insomnia. In the meantime, revert to those childhood behaviors of bedtimes, no soda with dinner, and relaxing stories before tucking in. Then, you'll be sleeping like a baby. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Sweet dreams.